Babies are expected to be immunized or vaccinated every 2 months, 4 months, 6 months, or yearly. However, with the raging COVID-19 pandemic, many mothers are afraid to take their children to the welfare clinics to be immunized or vaccinated. This is despite the fact that vaccines generally have proven to be the most cost-effective public health intervention across the globe. Ghana, through its expanded program on immunization (EPI), has successfully eliminated measles and poliomyelitis through immunization or vaccines. The expanded program now covers 13 vaccine-preventable diseases (VPD) instead of the 6, which were commonly referred to as the 6 killer diseases.
If you look at the sub-region, Ghana is one of the best in terms of not just the coverage, but impact of the coverage. Immunization has contributed a lot in bringing under 5 mortality down.
In late April 2019, the new malaria vaccine, Rts'S, was introduced and piloted in some 7 selected regions and 42 districts in Ghana. Its introduction was fraught with some misconceptions and miscommunications, yet the Ghana Health Service, the National Malaria Control Program, PATH, and health partners with the researchers were determined to roll out the vaccine.
We are still trying to heighten awareness, and especially doing the interpersonal communication, having at the back of our mind that the initial hiccups have also contributed a lot to the relatively low coverage, but it's not that bad.
Rts'S or Mosquirix, when administered, triggers the immune system to fight the first stage of the malaria Plasmodium falciparum. The vaccine prevents the parasite from infecting the liver, where it can mature, multiply, and re-enter the bloodstream and infect the red blood cells, leading to malaria disease symptoms. The new malaria vaccine, Rts'S or Mosquirix, is a 4-dose scheduled injectable vaccine administered at 6 months, 7 months, 9 months, and 24 months.
We try to merge it with the existing immunization schedule, because at 6 months you'll go back and take some other vaccines. So by the time you are 1 year, you should have 3 doses. And then at month 24, you come back for the 4th dose, which is referred to as the booster.
In one of the piloted regions in Ghana, precisely Cape Coast, lives little Ayeyi Ochre. Little Ayeyi, who is 1 year 7 months, was given the vaccine when she was 7 months old during the launch of the program in the region. She is yet to take her final dose.
Why did it take 7 months? Not in 8 months, not in 9 months. It's working 2 years. Zina over babaji. Oji so problem yam bay. On yari, on young crack, on Kawanya Marie. When you're in my battle. So why a BBA on my family, my 1 wasn't 1 year be more 1 year. 1 year not here, my family, what action.
Madam Patience Stando and Cecilia also shared their impressions about the vaccine.
Yes, 6 months more. You want malaria treatment. When you are 7 months, so the same thing. When you are 11 months, so you want. This is when you are 24, so also so what the one. One no baby brain was the one even though before now it was the one what prevents you from when you have malaria sickness. Now, baby, I want to away from food. Baby, I was one 1 year, was one.
In Kintampo South, precisely, Apesika is also another beneficiary. Maranatha Jesse Impienima, her mother, tells us the vaccine has protected her daughter, who was part of the malaria vaccine trials in 2006.
The banner, the Kaya, the one is happening now. If you are searching me, who should be a friend. Mara, side to man of Basho, I know my really been who are cannot for them to move, say, I plan none of more than Yankasa. None of more thing. Tia bedroom baby no, or more by the fire, the conquer them for echo shame. My who said, you don't know, and you know what they want. I'm a plan, and you're pumping.
However, experts believe COVID-19 may threaten decades of progress Ghana and the world over have made towards eliminating malaria, considering the challenges COVID-19 poses on healthcare systems and the entire immunization programs.
Unfortunately for us, most of our child welfare clinics are heavily attended, and to get the necessary spacing and social distancing is a challenge for vaccination, and then of course the other childhood interventions. We just hope that the effect on the health system won't be so drastic.
Innovative ways must be found to deliver these services whilst adhering to measures that are aimed at curbing the spread of COVID-19.
COVID-19 doesn't leave us soon. We may have to readjust and do some other special interventions in order to be able to catch up on not just Rts'S, but the routine vaccines as well.
COVID is a new disease, so we are all worried, we are all putting our hands, because we don't know how it's going to play out, whether it will kill more people in Ghana than malaria. So we are all putting in our very best so that we don't get there. But as you continue to stay at home and wash your hands so that you don't get COVID, you should know that the malaria parasite, which is transmitted by the mosquitoes are not on quarantine.
Many hope that with the introduction of the Rts'S malaria vaccine, malaria can be eliminated or fully controlled in many parts of the world, including Ghana. Malaria is still a threat. Let us protect our children and ourselves. Zero malaria starts with you. For GBC News, Mavis Ofei Champon reporting.